Oh, good afternoon, everybody. I appreciate it's getting rather late in the day. If I can read this. Apart from being a wife, a mother, I'm also a lawyer, and I'm hoping that at the end of this presentation you don't think it's all about the money for me. To give you an idea of my age, Ron and I were in the same class at law school, and I think we've both trod different paths. I'm now what you'd call the GP in the law. So, until 2005, probably my interaction with a GP was because my children were injured, and they were injured fairly often, and for illnesses. In 2005, I was diagnosed with breast cancer, and as a result of that, and wanting to make a contribution to women and to improve care, I thought, and there were quite a few women like me, that we would join various committees and boards to improve care, to try and influence the way women received care, the way they received information. And I've got a few of what I do up there, as well as run a legal practice. And I have been on, as far as GP practice goes, ProCare's, I'm trying to read down here at the same time, ProCare's Clinical Guidance Committee, which was very, very interesting. So, when I was sort of preparing for this, I realised that patient actually meant someone who suffered, and in my view, really, as GPs, you look after all of your people, okay, that are on your books, and also the people who have good health, they require your services as well. There's lots of good health messages out there, and of course people want to stay healthy. There's a move towards patients managing their own care, but to do that, of course, they need information. You know, this is not the sort of information that I'm thinking of. You know, they need sort of more information than that. Okay. Otherwise, you know, if you're reading that, otherwise, what happens is they look for information everywhere. And can you read that? I think you can't you? It says more and more patients are going to the internet for medical advice. To keep my practice going, I changed my name to Dr. Google. So we don't want them to do that, or though, having said that, if they are going to do that, let's give them some information on the internet that they can get, something that they can rely on. Patients or consumers, like I think consumer is a better word, because as I say, it's the well people as well. They see the world differently, differently to medical practitioners. And there's a picture here, and I invite you to look at it. And now the men there probably, it's their girl with a nice ass really. The younger women, they probably think, cool blouse, where can I get it? The older women like myself think, oh, never fit into that, never look that good. One cancer doctor that I showed this to a group recently, he said, oh, look, the car's driving on the wrong side of the road. He would, wouldn't he? Hey? But other people see that the dog is driving the car, okay? So we all see the world differently, and I guess that's what we're all saying up here, is that patients, all your people, because you've all been to med school and you've all been in training, that you need to embrace them. But it's not just listening to an individual, it's actually bringing them in and making changes to your practice. And I just thought briefly, if I had time, which I think I probably do, is just to say what's happening in cancer. Because they've been doing it for a little while now, because in 2008 they created, or the Minister created 4 regional cancer networks. And consumers have really been invited in. So, I'm sorry. We've contributed to the Care Coordination Project, and you might be interested to know that, and I think it was Geordie said, you know, you want one person who you can talk to all the time. And I mean, GPs do that to their patients all of the time, but we're now doing, they're doing that in secondary care. There's a bit more money from the Minister on that. And one of the main messages that came through from the work learnings of the Care Coordination Project was that people wanted for cancer the message of hope. And they wanted the message of hope right through the journey, because it's a disease that can possibly kill people. Not so many these days, but it can, and they want to hear hope the whole way through. Designing cancer services directories on the internet, you know, we had a big input into that, into making or user-friendly, so people would actually go there and they'd be able to use it. On the national tumour groups, giving the patient point of view, there's no point having services if people aren't actually going to go and use them. Things like parking, times of the day, who gives you your care, lots of sort of things that go just a bit further than the actual specialist treatment itself. We also assist with setting of priorities to the extent that we can outside what's required. And we also provide a bit of a reality check. I think there are times when we've actually sort of poured a bucket of cold water over a few plans because we've said, well, quite simply, it's not what people want, it won't work, it's a waste of money. And I think that that's been actually really useful to give that feedback, and in my view, probably we could do the same thing in primary care. So, the message that I had was nothing about us without us, and I think that Professor Berwick was talking earlier today. I read one of his papers a few years ago, and it was about people power, and what he said was nothing without me, nothing about me without me. And I just sort of made it into us, really, because I think we're all a team. I think that medical care, whether it be your GP, whether it be secondary care, whoever, I think we all have to work together, including the community. I think that's where we get the best value. And you might be interested, I don't know whether you do read the medical oncology models of care that have just come out, but they are looking to primary care to do more for cancer patients. And I actually always find it really, really sad that when I go to a few of these cancer meetings and I talk about follow-up care to primary care, because I've got a great GP and I think GPs do a fantastic job, the people in secondary care are absolutely horrified that anyone in primary care could look after a patient who's a cancer patient for follow-up. Now, I mean, you know yourselves that your cancer patients get the flu, they get a whole range of things and they come and see you all the time. So, I think there's work that needs to be done there to coordinate primary and secondary care. So, just to finish, people want to be in good health, you know that, okay? I think that those people with good health need good health messages to stay healthy. We've got for those of you who are on Wider Matter, I hope you're all encouraging your people to participate in the bowel cancer pilot at the moment, the screening pilot. And so what I'd also suggest to you that maybe we include patients in your committees and your groups and what have you that you have. They might just have a different look, they might have some suggestions as to how information can be delivered. And they're not all so bad, really. I mean, it's not going to be the end of the world if you include them, because they thought that with cancer. They thought that the world would end, it didn't. And it won't end in primary care either. Thank you.